so much again for being here. I'm Dr. Dylan Greeney. I'm a board certified dermatologist here to help you get your best skin. So I really appreciate you guys hopping on tonight. Again, I'm Dr. Dylan Greeney. My whole goal is to kind of help you guys get your best skin. We got lots of good questions rolling in already. So someone was asking right off the jump, does Accutane help with scarring? So it certainly does, because once you slow down acne scarring, and acne that's active, your skin and body can begin to heal. If you're still breaking out, you're still most likely going to have more trouble with acne, lesions and scars. So the biggest step in getting your skin clear is stopping the active acne process. And if you can get that under control, then your skin is going to help to fade about a third of acne lesions on their own, acne scars on their own. And then you can always do things like laser or microneedling and those kind of things to help get that gone. So extremely oily skin that's acne prone. If you're looking for one really great cleanser, I would look at CeraVe Acne Control Cleanser. It's got a really nice absorbent like oil, it like absorbs oil off the skin. And then it's also got a little bit of salicylic acid. It's going to dry the skin a little bit. It's great for acne too. So I really, really like that one. Triamcinolone for chapstick in the appropriate strength. It could be, it can be a decent one. That's a steroid, but it's a steroid, but I would not personally recommend doing this as a chapstick. You pretty much want to just use plain Vaseline. I would kind of stick with that. What can you do with vitiligo? I actually saw one of my patients today with vitiligo. We're currently using narrowband UVB, which is a type of UV light that's very narrow band, so it's not likely to cause any skin cancer. And it kind of treats the skin and it suppresses some of those immune cells that are in the skin that are fighting off the melanocytes. So we do it for that. How to remove deep close comedones. There's not a real easy way to do that, but if you're the dermatologist office, usually what we're going to do is we're going to actually use a little tiny 11 blade, and we're going to nick those and kind of get those removed. So that's usually how we're going to take care of it. Keep the questions coming, guys. You guys are asking great questions. I appreciate you guys being here. If you guys have any, questions about your, your skin at all, you can ask in the chat. Again, I ask you guys, if you're here and you guys love skincare, I would ask you that you tap the screen, guys. Tap the screen. It's the biggest way to help. Just run those taps all the way up, run it up till it hits 100, get the confetti. That's the best way to support the stream and kind of keep this live fueled up. I'm going to be doing a little bit of playing games. I'm going to be answering your skincare questions. Again, for those of you guys who don't know me, it's on this side. I'm Dr. Dylan Greeney. I'm a board certified dermatologist. I'm here to help you get your best skin. I want to get you guys glowing skin. And again, if you're looking for that great skincare routine, you want to have at least 3 things in it. You're going to want to have a great cleanser. You want to have a great vitamin C in the morning. I like Brandify. I like Vichy vitamin C is very good. If you're looking for something gentle, I like ROC vitamin C. And then at nighttime, you want to do a great retinoid or retinol. Again, Brandify makes a great one, but you could also do like one of the strongest topical retinoids you can get over the counter, which is going to be La Roche-Posay Effaclar Gel. It's very good. Someone says, Doctor of Wish. Is wish.com like Temu? Is that, I forget if that's a jab. So DIY Zed, thanks so much, man. I appreciate you. Thanks for hopping on. Appreciate it. What is the treatment for basal cell carcinoma? It just kind of depends. Basal cell, for those of you guys don't know, that is the most common type of skin cancer, and about 1 in 5 people get it. So depending on the type of basal cell, and there's actually multiple types, there's like superficial, which is only in the top layer of the skin. There's nodular, which goes a little deeper, and then there's infiltrative, that is really like kind of sneaky, and it likes to grow roots and spread out. But most of them are going to be cut out generally. But if they're only in the top part of the skin, one really nice way to kind of treat that is just doing something called electrodesiccation and curettage. It's just scraping away the top layer of the skin, and then usually just keep it clean and keep it Vaselined up, and that's going to be the main way to do it. There are some other prescription topical medicines that are available for basal cell carcinoma too, like Aldera, which you have to put on, maybe 5 days a week, and do that for quite some time to kind of get it to clear. But that's a good question. Is it true that isotret damages your liver? Generally not. Now, it's not a good idea to drink while taking isotretinoin or Accutane, but for most people, they have no problem at all. I will say sometimes elevated liver enzymes can be seen, but by far, I see a little bit of bumps in cholesterol more than I see the other like liver changes, right? So thank you guys so much again. I'm Dr. Dylan Greeney. Thank you so much for being here. I see there's like almost 5,000 taps, guys. I know if you guys are here and this is helping you, if you guys tap that screen, it really is going to make the difference in the life of the night. We're literally just getting started. So keep the questions coming. I'm going to keep answering them, and I appreciate you guys. Is clindamycin good for dry skin and comedone type acne? So Not necessarily. It doesn't help dry skin really. The lotion thing maybe is a little less drying, but it's not like it's a great moisturizer. So I would kind of, you know, I wouldn't really look to it for that. For comedones, that's going to be blackheads and whiteheads for those of you guys that don't know. And really the gold standard treatment of that is going to be tretinoin. So tretinoin is going to be your number one treatment for that. How do I treat ringworm effectively and fast? I use a lot of ketoconazole cream if it's mild, but for some people with more extensive cases, I personally use oral terbinafine, which is a prescription, but it just kind of depends. Dry, dehydrated skin at age 57. If you're looking for things for the face, I really like the Kiehl's overnight rehydrating mask with squalane. That's a very good one. If you're looking for just a great moisturizer for the body, there's La Roche-Posay triple repair moisturizer, which is actually this one right here. And this is one of my favorite body moisturizers for the winter time. It's very thick, it's very rich, it's very hydrating. Differin is actually very good. Yes, I love Differin. Differin is very good for acne. It's also very good for anti-aging. But if I had to pick one, I would definitely pick the La Roche-Posay adapalene because I love the instructions on the box so much. I think it's very, very good. So that's one of the things I definitely love. Perioral dermatitis, I don't want to take antibiotics. You can do topical treatments too. I like a topical combination of metronidazole, ivermectin, and azelaic acid. That's my favorite. You can get a prescription from a compounding pharmacy. So that's one thing I really like doing for people, and it works good, especially if they're not in a rush. If you're trying to really get it under good control, the other thing you can do though is take, you know, you could take an actual antibiotic, and that antibiotic is really going to do the best for you. So, but it just depends. People have different reasons for not wanting to take an antibiotic, and that's fair. But, you know, like a lot of people, if you take an antibiotic, you know, you're going to get better faster. What would you recommend for micropigmentation for vitiligo? I personally, you know, you could look into it. It's certainly not a big go-to, and it's not a real derm driven like solution to it. So, you know, it's up to you, but overall, you know, I would probably recommend treating it medically rather than do it. I would treat it probably medically rather than do the micropigmentation personally. So yeah, so that's what I would kind of go with. I'm going to get one of these games started here. How to reduce PIE while on isotretinoin. The key is, for one, Natty, thanks so much for the roses. I appreciate you. So PIE, you want to be patient with it. When you're on isotretinoin, you really don't want to do too much necessarily. You just kind of want to take it easy and get your acne cleared up. That's going to be the key. But you can do lasers and that kind of thing with that, you know, if you need to. Maybe if you want to use a little niacinamide during that time, I don't think that's going to interfere with that. So I like Pi. Yeah, I agree. I think that was that Body Yaddy Yaddy that said that. Yeah, I don't blame you there. So let's see. History of atypical moles, and I'm more at risk for melanoma. What is the percent? So I don't know if I could give you a strong percent of like your risk for melanoma, but I would say if you do have atypical moles in general, you probably are a little bit more likely to get melanoma. You're also certainly way more likely to get more atypical moles. So you want to watch things closer, and if you know you grow abnormal moles, then you do want to get your skin checks regularly and watch for those changing signs of moles. So let's see. I forgot what my talk key is on here. So 40-year-old female lost 30 pounds. I missed that. Dylan, thanks for being here. So again, I'm Dr. Dylan Greeney. I'm a board certified dermatologist here to help you get your best skin. So any questions you got, feel free to ask. Is there an actual cure for seborrheic dermatitis? Not that I'm aware. I don't think there's going to be something that's going to cure things permanently for you, but you can treat it, you know, over the counter using so let me see. I'm going to back out here. Bulong, are you in, buddy?
Sir.
Okay. So we got Bulong here too, guys. Say something real quick. We want to see if you're working.
Hi, everybody.
Yeah.
How's it going?
Good. So yeah, Bulong's on too. I think you're partied up with me, right?
Yes, sir.
So good. So keep the questions coming. At GHKCU, I get asked all the time. Hey there. Hi, Meg. Thanks for being here. Appreciate you. What is this? Unavailable with party. Do you have the game installed, bro? I don't think you have. Probably have installed.
What is it? B?
Yeah, it says not available. Yeah. I mean, quit the game. So yeah, you can. So we had Meg said hi Bulong, by the way. Yeah, I think you got to install. So
Oh my
yeah,
goodness.
you got it. So let's see what else we got. Eva, Ben, thanks for being here. Try to see Meg's pinned comment. I can't see any of the other comments right now, to be honest, but keep them coming because it's going to go away and then we're going to be able to see what's up. There we go. So I have more. Should I go on Accutane? So Accutane is the best treatment there is for acne. The only thing can cure acne permanently. Best lotion for dry skin on the face. I like CeraVe moisturizing lotion. That's one of my favorites. Yes, please feel free to pin any good ones you have. You know, Meg is one of the moderators, so I just want to thank Meg for her help in the chat. You never finish your thought on Sebderm. Yeah, so over the counter, you can get ketoconazole 1%, and you can also get hydrocortisone 1%. That would be something that's reasonable to try for little seborrheic dermatitis, which is a rash that's kind of like face dandruff, and it kind of happens between the eyes and also around the smile lines and that. So I like that. I also like using Nizoral shampoo as a face wash. So that's something else. Syringoma treatments under the eyes. There's not a super easy way to treat those. They can be treated some with laser. They can be treated with laser to just kind of flatten them out a little bit, but the trouble is they grow way down in the dermis, so they're down in the deeper level of the skin. Berkeley asked about, do you like tretinoin? So tretinoin is one of my favorite like topical treatments of all time. There's nothing that's better than your skin aside from sunscreen than tretinoin. So tretinoin is very incredible in that way. It helps with fine lines, wrinkles, dark spots. It boosts collagen. It helps with acne. So pretty much anybody should be using tretinoin if they have it. If you failed Accutane and don't want to do it again, I mean, Accutane is going to be the best thing for acne. Just depends. If your acne's mild, I don't know if you're a guy or a girl. It looks like, is it Digity? The, you know, if you're a lady, sometimes spironolactone can be a very big help for people. Best cleanser for day and night routine. I really like, if you have clogged pores, that CeraVe acne control cleanser is very good, but it is going to be a little bit drying for you. But if you're looking for just a good all-around cleanser, the CeraVe acne control cleanser, sorry, the CeraVe cream to foam cleanser is very good. Just keep me updated, boo. Okay.
I'm coming back in.
Okay. So tretinoin versus retinol. If you have tretinoin, definitely go with that. Retinol is going to be less irritating for you, but tretinoin is going to be more effective for acne and honestly more effective for anti-aging. But you know, your retinol you can go pick up at any drugstore, CVS, Walgreens, whatever, Walmart. You can pick it up. So tretinoin, though, if you have the prescription, definitely use that over and over the counter. Yeah, keep the questions coming, guys. How to get rid of papular acne scars on the nose? It ruins me. I can't get laser. It's $1,000. So that's true. Lasers, you know, can be a bit pricey, no doubt about it. But if you have like bumps, and who knows, I don't know if you're saying you have scars on your nose, it is going to be very little you can do with that without like procedural treatments. And the nose does heal very well. So for somebody that like came into me and they had bumps, I would recommend laser myself. Laser is going to do the best job of it, and it's going to help to get those smoothed over really nicely. So there's probably not a ton you could do at home besides keep up with your retinoids and that. What do I do for ashy dermatosis? So it's a really it's a very tough condition to treat. There's a lot of different treatments for it. None of them necessarily work great. So that's one you want to follow with the dermatologist. Most of the things you're going to have to try to like take your time and give it time to work, but it's not great. Prescribe 5% retinol. So you're probably talking about tretinoin 0.05%, which is half strength. And most of my patients do, you're all good to go.
Hopefully.
Do you have the high since the high shaders done?
No, I'm not doing any of that.
You can do it, bro. It takes 2 seconds.
No, go ahead.
Okay. So, do you, the question was, what was the question, Belong? Did you hear it?
No, I did not hear it.
So laugh lines and on the lower face, those are the nasolabial folds. For those, you do want to kind of lift the, you know, like a lot of people are like, ooh, I just need to like the lift like this. If you're really tightening and lifting like that, the only thing that's going to do that is surgery. But you can do a little filler up by the nose, which is very helpful for lessening the depth of that line. And a little filler throughout the line can help too. So that's the way I'd go with it. Fort Linden, first time, the epicenter. We're doing it, guys. We're on Battlefield 6. red sec, right? We're on red sec. The boys are here. Boolong's here. The chat's full. We're taking skincare questions. We've answered hundreds already. Best moisturizer for Accutane dry sensitive skin. I like CeraVe moisturizing cream in the jar if you're very dry, which you probably are. For the lips, I like a special type of lip balm called Dr. Dan's Cordabalm. It's very good. And then you can also use Vaseline, obviously, for that too. So that's good. My boyfriend has eczema, been really bad recently. Any advice? Definitely going to get worse as the winter months march on and the heat's on in the house. So you're going to want to make sure he's moisturizing immediately after the shower, and also ideally moisturize before bedtime. Humidifier in the bedroom sometimes can help too. And then from a moisturizer perspective, again, we talked a little bit about the La Roche-Posay Triple Repair Moisturizer. This is a really good one for the body. It's not like greasy, but it's definitely a heavier, richer moisturizer. So I'd go with something like that. Chronic TE, I mean, probably like 6 months, but you know, chronic TE is just that, it's chronic. So sometimes it can drag on quite a bit longer. So you just want to kind of do your best with it. You know, some of my favorite treatments for chronic telogen effluvium, which for those of you guys don't know, sometimes you have an illness, maybe a sickness, you break a bone, or rapid weight loss, and you shed a lot of hair. So we're gonna lock in here. This is the first red sec, boys. We're talking. When I say boys, I mostly mean girls, because 80% of the chat is women, which has always been funny because gaming, and I think women, sometimes you guys don't like, people in your life gaming as much as they do. But here we are. Dupixent is literally like a miracle for eczema. So Boolong, we're gonna look at the map here. We're shooting over here, okay, Boo? I'm just trying to figure out how to mark.
Here.
Oh, ping with Q. There we go. So I'm deploying, bro. Oh, it follows. Uh-oh. So it's marked. So how do I...
Oh, it didn't show you. I had the main map open. I didn't... Oh, there it is.
Yeah, it's there. All right, guys. Give us tips for the game. I'm giving you guys skincare tips. Make sure to give us tips for the game. Make sure to drop where you're at in the chat. Make sure to tap the screen, guys. What's crazy, dude, is crazy that we're only at 3,800 taps right now. That's actually insane. So we got actual fire on the edge. So how do I fix sebderm on the face? Ketoconazole shampoo, at first it worked. So yeah, it's going to come and go, right? It's going to be something that it doesn't get cured completely. So you're going to have to keep up with work to kind of keep it happy. Seems like a good thing to open. Or what? Are all the chests orange? I got an orange crate right off the jump.
Nah, I think those are the better ones.
Oh, the better ones? Okay.
Yeah.
Oh. Oh. I just flashed myself back. So, replace. So, one primary. Do you like sarecycline or Accutane? So Accutane is like 1,000 times better than sarecycline. Sarecycline's like a little bit of a temporary fix. So you got that warning, Boo? The fire moving in?
Yeah, I see it.
Wow, dude. Crazy. Best non-greasy treatment for plaque psoriasis. You can get actual prescription steroids that are creams rather than ointments. However, I always encourage people to use ointments. So 5 is your plates, bro. If you didn't know.
So safes can be cracked by the engineer, just so you know.
Oh, okay. Yeah, I did not know that. There were safes in Battlefield 5 too. How do you get rid of pores? So there's no way to get rid of pores permanently. But one of my favorite topicals that's available over the counter for pores is it's called Remedy for Pore Size, and it's made by a company called Remedy. So I would personally grab that. That's a really good option overall. Okay, how we doing, Bilon? Fire's getting closer. Forward eye spots, I've literally tried everything for, and I haven't found anything that really particularly works well for it. We have a helicopter here, bro.
I mean, that's up to you.
It's gonna be.
I don't know how to fly it.
You want to try to get high ground with this? I'm in.
As long as you know how to fly it.
Oh, I know how, bro. You don't worry. Oh, are you in with me already?
Yeah, man.
Oh, okay. Sorry. All right, guys. Where are we going? Is that shots?
No.
Oh, it's like a weird. So where's the high ground? We don't have any like snipes, but please, pustular folliculitis. So my favorite treatment overall for that is going to be doing CLN body wash. CLN. I love that one so much. It's a really, really good one. How to get rid of eye bags. So really one of the best treatments overall for eye bags is going to be, there's a ladder in. I think we land here. What do you think? So for eye bags is going to be surgery. However, you can get some mild improvement. You can get some mild improvement. What about that landing job? You can get some mild improvement with lasers. So that would be something you can do. Are we shooting it? Yeah, there are.
Make your way to that point.
Shooting our helicopter. Uh-oh. So IPL for redness. So IPL is a treatment you can do for redness, but better lasers for redness would be things like DermaV, PDL. There's different things that you can do. So DermaV, PDL. There's another. So if we jump off here, can we fly?
I'm pretty sure we can.
There's another helicopter down there too.
Enemy helicopter!
So do I need sunscreen? Absolutely. Sunscreen is one of the most important things you can do for your skin. It's literally the most important thing you can do. You need at least SPF 30, but I usually try to aim to an SPF of 60. So, or sorry, SPF of 50. That's going to give you 99% protection if you're using enough of it. You need about 2 finger lengths on your face and neck. But for the body, you need closer to like a shot glass amount. So thank you guys so much for the follows. Again, thank you guys for being here. Got artillery on us. Is cologne bad for your skin? There's a lot of people that do have fragrance allergies, but yeah, a lot of people do have fragrance allergies, but it's maybe, I don't know how many people, maybe like 4% of people or so. That may be wrong, me telling you the wrong thing. But if you don't have trouble with fragrance, then you don't have to sweat it and you can enjoy it. Like I wear cologne every day or whatever, but like it's if you are sensitive to fragrance, it's good to know that so you can try to avoid some of the issues. Just drop some over there. What's this thing? Oop. Looks like a grenade. Thoughts
What
on
cologne does the doctor wear?
what cologne does this doctor wear? I wear Creed Aventus.
Oh,
Yeah,
Creed.
yeah. But I go through a lot of different stuff. Fortunately, I've tried a lot of different things. So the YSL colognes I'm quite fond of too.
I bought me some just the other day, and I bought me a bottle of Savant.
Oh yeah, absolutely. Savant smells so good. I know it's like, the thing is like I guess a lot of people do use it. So it's not, you know. So we got multiples below us, bro.
On that
Ouch.
position.
Oh, on our.
Oh, on us? Can you come to the roof?
Yep. He's.
Here,
Alright.
I'm coming down. You want to come down or are you coming up? Hold this. When do I think of Anua? So, I mean, Anua incredibly trendy on TikTok. I don't know that I haven't like tried like a ton of their products, to be honest with you, but I know they're very, very popular. They're very trendy. So run out of this ammo? Purple armor. Microneedling thoughts. Docs, can we get stickers, please? You guys want stickers? I think we should do that. Yeah. What kind of stickers? What should they say? I don't know if I have any like primal branding. Like what do we say in here usually? Do tinted sunscreens clog your pores? No. They're actually the better sunscreen to use. So I have a mortar strike too, bro.
So do I.
Cool. Did something? Oh wait, no, there's ammo up here. I was like, I feel like my ammo just refilled, but it's...
Yeah, I'm supplying you.
Okay, nice. This is here. The fire is here.
Huh?
There's one here. See him?
Hostile machine gun in sight.
You want to fly down to that top of that building? So what do you think about Juvederm? So Juvederm's a type of filler that's hyaluronic acid. Generally, they're going to last about 1 year to 2 years. He's still here. He's on this mountain. We can probably take him right here.
I got enemy in sight.
Got a little bit of a bloom, they say. Does
I hit him twice.
you hit him twice? I think I only got him one time. I wonder if this dude's close. Also kind of wonder, do you know much about the missions that are available?
No.
Why is tinted sunscreen better? So tinted sunscreen blocks from blue light, and you'll hear people talk about blue light in the context of, you're going to hear people talk about blue light in the context of like phone screens and computer screens and stuff like that. No flashbacks, body yaddy yaddy, thankfully. For you guys that don't know, I was in the army for 8 years, and that's how I got into medicine. But so you'll hear about blue light from the context of phone screens and computer screens. However, the biggest producer of blue light is the sun, and blue light causes hyperpigmentation in dark spots. So that's why it's so important to use a tinted sunscreen, because it blocks from that blue light exposure. Why does Botox only last 3 weeks for you? It could be that you're using like a very small dose, but if you're getting like a good dose, like you came in and you did your full face and you did like 64 units or even 50 units, like you should get a good result. There are a fraction of people, like 1%, that do make neutralizing antibodies to Botox, and that could be the case, but it's quite rare. Is sun pseudo cream good for reducing acne? No, not that I'm aware of. I've never used that. I'm not quite sure exactly what that is. 25 squads remain, or 25 people? Squads. So what's this mission say? Weapons cache, find bolt cutters and break into the cache. So does it mark it when you do that? Oh, you see it marked on the map?
Sure does. Yep.
You want to try it? I mean, I think there's a tank here. So what about hyaluronic acid? So my favorite hyaluronic acid is this one right here. It's Vichy Mineral 89, and it's a great volcanic water hyaluronic acid that is incredibly soothing. You can find it pretty much anywhere, and it's great, especially for like holding a little moisture on your skin. So
I'm in trouble.
you're fighting the tank? No, I see the guy.
Fighting people.
Yeah, I see the two. He actually is white. He has no shields, I don't think.
Oh, I cracked from both, so.
Oh, good. Yeah, I'm here with you.
Request immediate support fire.
So I got one actually. I got him, I think, with the mortar, bro. He's got a,
really?
Yeah. So it comes in pretty quick. It's still hitting. Look at that huge circle, bro.
behind him, behind us.
Oh, thank you. You want me? Where should we be?
Roof.
Roof? Okay. So,
He's on the roof.
what about Neutrogena water cream? I love that one overall. There's one right close behind us.
You need plates.
Thank you. He's white inside the building now. And the other one's on the roof. I have no plates, sadly.
136 on the roof.
Okay. It's rough, bro. I have no plates. I'm trying to fall back a little bit. Taking shots. Ooh! Bad, bro. I'm falling back again.
Hit him twice.
Thank you. I'm falling back just because I'm out of plates. I'm gonna try to get this building and see if I can get some. How often do suspicious moles end up as cancer? I mean, there's a lot of times they can potentially turn to cancer. So, you know, we'll check them if they, you know, meet the different criteria that we're worried about for skin cancer. But there's a question of like, how much do atypical moles evolve into skin cancer, you know? So it's always a good idea to get any abnormal moles checked. Can you drop plates, or you not really have any?
I don't have.
Okay.
Hey, I thought.
Yeah. There's a mortar I see marked up here. It's a box. Should I go down to it? Yeah, there's a plate in here. Got one plate. I'm coming back up to you.
Yep.
So let's see. Your favorite vitamin? Oh, they're at the top. So
All right.
they're at the where the rope I came down
I
at.
see 'em, I
Is
see 'em,
where
I
they're
see 'em,
at.
I see
Yep.
'em.
I wish I had skin like yours. So a lot of this is good lighting, honestly. Like I got really good lighting, and I put on a little like Obagi. Nice, bro. Well, that was a good first game. Try it out. Got some shots. Got a kill. Like it. Dupixent is one of the safest injectable treatments for eczema. I love Dupixent. It's been out a long time. You don't need any lab testing. So, you know, it's a discussion to have with your doctor, of course. But I like Dupixent. It's actually approved for kids all the way down to 6 months age. I think that's pretty rare to need it in kids that age, but it is approved by the FDA all the way down to age of 6 months and old. This is Battlefield 6 Red Sec. So this is the new battle royale for Battlefield 6. GHK peptides, I really don't have any, you know, I've never used them. I don't really know a ton about them. Hey there. Thanks for saying hey. What's up, guys? Is BHA good for cleaning out pores? It's very good for pores, and like comedones, like blackheads and whiteheads and that kind of thing. So it's good for both. Yeah, good for both of those things. And then for fine lines and stuff, I usually like alpha hydroxy acids more. But there's a benefit. Alopecia areata is usually treated with topical prescription steroids. Usually strong topical prescription steroids is a good way to treat it. Pore strips temporarily do work because they'll pull out like those sebaceous filaments. But you know, you're always gonna have pores, and you're always gonna be able to notice that, right? Are there any foods that help with KP? Not that I'm aware of. What are you going in as? And should I play? Is it like, should I pick something in particular?
I would do engineer or recon.
Okay.
Or I can play recon if you want to play support. It's up to you.
Okay. How do I
Hold on. Who joined?
change class? You want me to play support?
Oh, Move's in here.
Hey, Move. We're streaming, just so you know. Why do I only get red spots? So anything that causes any kind of ear inflammation or irritation, you can definitely get like red spots left behind. That's called post-inflammatory erythema. So it does typically heal with time. Scars that are divoted in, those can be like more of an issue. How do I fix acne scars? Usually gonna be laser and procedures. Those are gonna be the bigger way to help improve those. Usually takes multiple treatments. It's not like it's a one and done thing. What are those bumps under the skin of my face? Most of the time it's things like milia, which are just little clogged up oil glands, is the most common.
Back out.
Okay.
Back up.
So I back down.
Do, 4.
Do a quad. Okay.
Yeah, no.
How did I get rid of the dry skin on my face? So you usually, hey, 512, what's up, buddy? Thanks for being here. So we're all in now, right? We have the three. Okay.
Yep.
Okay, got it. So let's see here. Advice for a DO student trying to match derm. Just show your passion. Obviously do good rotations, make a good impression. Jill, what's up, dude? I miss you, Jill. Sweet Jill. Was the best. She is the best, I would say. I miss you, Jill, lots. More than words can express. So let's see. Oh, thank you so much. No, it's so true. So I can row support. Wow, look at you guys both sniping. Am I gonna be support? Wow. So any suggestion a home red light mask? Yeah, I would go either current body. Shark Beauty makes a really good red light mask too that I like. So you could do that too. They're very nice. They do these like cooled little eye pads underneath it. Is very good. Very incredibly difficult to match into derm actually. So I usually tell the story. There's about 600 people that apply to my program for dermatology at IU. And then we would interview 30 of those people and you could accept 4 per year. So it's really definitely tough. Best way to remove clogged pores. Again, good salicylic acid cleansers. I like CeraVe Acne Control Cleanser. That's a very good one.
Back out. He crashed.
Oh my God. All right, I'm back. So yeah, I was having some crashing before this update. Why do I get white spots on my head? It's hard saying exactly. There's a lot of different ways that you know, a lot of different reasons you can get that. Good for crow's feet. 512, by far the best money you'll ever spend is going to be Botox or Dysport, Javosium, and any of the neuromodulators. If that's your problem, you want to just do Botox. It's going to make the biggest difference. So you can spend a lot of money on eye creams and stuff like that, and that's fine if you want to use like a great eye cream like Brandify Retinol Eye Serum. But let me know when he's good. I've tried everything for closed comedones. Nothing works. So the two things that are gonna, it lasts 3 to 4 months, 512. The what works for closed comedones, I've tried everything. So the two, you want to be using a salicylic acid cleanser that's 2%, and you also want to be using like a retinoid like adapalene. Those are going to be the main thing you want to do. So yeah, I would like use those things. That's going to be the key. What can help with dull skin after Accutane? A lot of times your skin's going to be more dry and it's going to give it maybe a little bit of a dull appearance. Usually after about a month of being off Accutane, some of your oil production ramps back up and then you'll be doing a lot better. So that's the main thing there. Did you get Bottle Pass, Bulong?
I'm getting it now.
I like CeraVe a lot. Someone said, isn't CeraVe not that good? No. CeraVe is very good and actually probably the most, it's like probably the most recommended products like line that I recommend in my clinic. Really great moisturizers and really great cleansers, which is like the core of a good skincare routine. Redness, is it the battle royale? Yeah, I've been playing it. Is it lit? It's hard to say. So I actually liked it. It felt like a slower movement to me. What do you think, Bulong? It felt like I was like slower moving.
I think so, but I'm kind of being cautious because I'm not knowing what I'm doing.
Yeah,
I don't know what I'm doing. So
that's true.
I mean,
I think we have a very little read on it so far. Like I barely looted because I was like, I don't have the eyes for it. Like I'm like, oh, what's in this? And so you can only pick up one primary, right? And then you can pick up one lethal.
yes.
And then you can get like call-ins, they call it, right? So I picked up that mortar, but it came in like the mortar, like when you go to fire it, I don't know if you fired the one you had, but you gotta hold and paint the target. So you gotta get line of sight for a minute, and then once you call it in, it actually happens pretty quick. The best over-the-counter you can do for hidradenitis suppurativa would be like CLN body wash, but you really need medical therapy for that. We use things like doxycycline, spironolactone for that, the clindamycin lotion. Sometimes I do surgery for it, and sometimes I actually do biologic injectables. So what's the best for dry skin on the face? I like CeraVe moisturizing lotion. But if you're looking for something super duper rich and hydrating, Kiehl's overnight. I'm gonna go ahead and launch if that's okay.
Yeah, he should be in, right? Is it?
Yeah, it says preparing game still, but I was able
Oh,
to take the invite from you.
okay.
So.
No, if it's preparing, let it do its thing and just tell us when you're ready. Okay.
Yeah, it's just verifying shaders right now.
Okay, perfect.
Not repairing, preparing.
Okay, preparing. You can microneedle at home. If you do it, use a stamping one. Don't use a rolling one. The Banish 3.0 is good, and also the Cure micro infusion system is very good. How do I get rid of deep-rooted acne? If you have, they could even be cysts, right? So sometimes it almost takes more of a surgical approach or poking them and draining them. But if your acne is all calmed down, you know, maybe that's a good way to do that. Is base skincare good? I've never used that. You know, when I recommend skincare for you guys, I always recommend products that are I personally tested, usually are going to be affordable and effective, and I like them. So yeah, microneedling definitely does help with mild acne scars. It can kind of help boost collagen and smooth those out some. The ones it doesn't help with is going to be ice pick acne scarring. So it's not going to be really great for that, but rolling acne scarring, it's very good for, and then some box scar acne scarring it can help with. Best nasolabial treatments: filler up in the piriform fossa, filler in the nasolabial fold, sometimes cheek filler. If it's real bad, facelifts obviously are going to help.
I am ready to go.
Alrighty, we're loading in Battle Royale quads. Red sec. Let's go, dude.
Hopper might be on in a little bit. I
So,
think he was getting the kids to bed, and then he said he'd hop in for BR.
perfect. Best thing for back acne, I would go like a Panoxyl 10% body wash. So Panoxyl 10% body wash, probably like your best bet with that. But a lot of times if it's on your chest or back, it's going to be harder to treat than it is for your face. So usually going to require prescription treatments.
I got one for you, Dr. Greeney.
What's up? What you
I
got?
get these little bumps on my arms.
Yeah. What part of your arms? The upper arms? The tricep?
Lower arm, just below my elbow, like all over my arms. And
Really?
It feels like acne, but it doesn't ever get red and like irritated like acne.
Okay. Are you a hairy fella?
Not really.
Not really. Huh. It's hard to say without seeing it. Sometimes that's the case. Like, you know, I was kind of hoping to tell me upper arms. I could probably tell you it's keratosis pilaris. The arm, you know, it's a little hair bearing area down there. You know, you could obviously get folliculitis there. Is there any time of the year it tends to come up?
All the time of the year.
Yeah.
It got better since I started taking an allergy med, but
I'm taking an allergy med. So, that helped to get better. So does it ever get scaly or anything?
yes.
Retinol does help fine lines, by the way. I just want to shout out to the person who asked the question about does retinol help fine lines. So it does. Retinol is going to be one of the top 3 things you can do for your skin. So definitely want to do that. So you were saying what again, Move?
Yeah, it gets scaly.
Gets
Dry and
scaly. Okay, gets dry and scaly. So I mean, and I forget how old you are.
Almost 40.
And they stay there?
Well, I pick at them.
You pick at them. Okay. So yeah, no, you're human. That's what I tell my patients. Like you're human. They're gonna come up, right? So, and it's hard not to pick at stuff when you got little bumps on you. Well, I mean, you got to get checked out by a derm, bro. I'd say you got to get looked at in person because there's a lot of things like there's literally picker's bumps, which are called prurigo nodularis, which are like small pink bumps that people usually rub and pick at. I do specialize in hair loss as well, so I do that. But yeah, those little bumps, you know, want to get them checked out because, you know, worst case scenario, right? You have sun exposure on the lower arms like that, and it could be even like actinic keratosis or like little precancerous spots, right? And you don't want to let that roll, you know. All right, boys.
Fair enough.
Yep. So I get looked at, but it's hard saying for sure. So the jump leader, bro. Let's go. Let's work the back end of area 22B. Mark quadrant, bro. We're dropping there. So what's good for severe eczema? So severe eczema, the best treatment that you can get for severe eczema is called Dupixent. It's a prescription treatment. So
When do we jump?
I think we jump now. So here's the problem though. Last time I tried to hit that button to jump and it wouldn't. So It is expensive, but usually going to use like insurance to cover it. Some people who are completely uninsured can get the medicine for free, sometimes from the company. How do you get rid of acne on my cheeks? So the best treatment, like the best regimen for acne, is going to be like a 4 or 5% benzoyl peroxide cleanser, and then you want to use a retinoid at bedtime, like La Roche-Posay Effaclar Adapalene gel. I think I hear somebody on me. Wait, no, maybe that's you, Milo.
You want to take over the watchtower, or you want to left?
Well, you guys don't
got
come.
a chopper on us.
Okay. You guys don't come in with any kind of sniper or nothing?
No.
What works best with metronidazole? I like to actually combine it with azelaic acid, and you can get azelaic acid over the counter, but you know, it's reasonable just to try your metronidazole at first. I'm getting shot. It's up in the tower, by the way.
Yep. Issue.
I put some shots back on him. Got one here.
Contact enemy infantry.
So bruises, but nothing there. So yeah, there's a lot of people that get bruises. Oh, engineer repair tool. That safe's pretty cool.
Okay, that's on me.
Are you actually live right now?
I'm live, bro. We're live. We're doing it live.
Eh? Damn.
And trying the game out. So we've only got one game in though. We got Chris in the chat. Say what up, dude.
What's up? What's up? What's up, fam?
There he
What's
is.
up, fam?
I just killed over on 3.
We actually you're down, bro? Uh-oh.
I'm dead.
No, so there's no bringing you back, but you come back on your own. What's the timer?
Yeah. I got 20 seconds to redeploy.
And you get one
died
redeploy, or you get to come back
over
multiple
on-
times?
One redeploy unless somebody brings you back.
Oh, okay. So we got room for you too, Chris. So we got room for one. So that's
All right,
good.
you let me know when. I'm dropping right now. I'm just gonna try to
Yeah,
play
just feel
while
it
I'm waiting
out.
for you guys.
Is Accutane healthy to use? Most people do not have any trouble taking Accutane, I will say. Most people don't have any trouble. You will have dry skin. Sometimes your cholesterol levels can go up a little bit temporarily, but that's usually not a problem. We watch the triglycerides closely. But yeah, it's usually no problem. We got one close. He's white. No armor.
Make your way to that
He's
point.
kind of on the markers are kind of hard to see, aren't they? If you mark it, they're kind of far away. I feel like the loot is also sparse, isn't it?
Yes,
Well-
this is very sparse.
All the cases are open in here. That's why I jumped over to that other side where I died.
Huh. So
So what's your first thought, my friend? Be honest with me.
So the gameplay feels slower, which I think is probably welcome. The maps definitely are big, and because you know it kind of feels a little slower, I think it's a welcome situation here.
I got my drone out. I don't see anything.
Oh, they're like they're on us right now. We're fighting them,
Well, yeah.
but
I'm marking them.
okay. You're just getting a feel for it still, to be honest, at the moment.
Oh,
Just
from
two?
my left. Yep, from my left.
Big
Just two?
They're yeah. Oh shit! I'm getting shot from the other side. Uh-oh.
I'm down.
I'm about to go down right now. Yeah. So don't know if the medic will be able to get me, but
Right
so let's see. What would you suggest for hormonal acne? The best treatment for hormonal acne overall is spironolactone, which is like a blood pressure medicine that you can take. Yo doc, I've seen you consistently. Well, it's good. I'm glad I've been on the page here. We've had pretty good lives overall. The other night, it was obviously like a Friday night or Saturday night, so easier to kind of get a bigger audience that night. But what should I use for inflamed acne? Second chance disabled. Yeah, this is interesting. Does skincare help with dark under eyes? It's a tricky thing to kind of improve. You can use good retinols under the eyes. One of my favorite ones is Brandify Retinol Eye Serum. That's a very good one. You know, you can do different types of lasers under the eyes to improve the quality of the skin under the eyes, but it is kind of tough, you know, there's a lot of different factors that play in. Oh, that's kind of cool. Little XP booster pickup I just got. A little golden box.
I don't know how to use those kits that you get, Boolong, but I think you just picked up one for that shotgun.
Gunsmith kit. Huh. Cracked hands and eczema. So, you know, the main go-to is just you know, heavy occlusives like Vaseline. So Vaseline is going to be a really nice, cheap, easy thing to do for you know, cracked, dry hands. You could even wear gloves at night just to kind of further seal in that moisture in your hands. Yeah, I'm totally still getting the feel of this stuff.
Yeah, you want that kit?
Oh, you can run 2 primaries.
Yes, you just have to switch to your pistol to drop it.
I see. Currently med student, what's the easy research to do for the first time? I mean, I hate doing research, to be honest with you.
Kodachromes, photo quizzes.
Wait. Oh, did publish?
Yeah.
Oh, okay. So so Chris, I didn't want to put you on blast, but so Chris here, he's a dermatologist too, out in California. You guys probably know him from social media, but he was saying publish Kodachromes and what, like case studies?
Yeah.
Kodachromes, case studies, clinical images, clinical vignettes. I didn't do a ton of research, honestly, like myself, but I think being a veteran helped me a lot because that was kind of like my major kind of extracurricular thing that I think people were interested in. But you want to have some research because if you just come up with nothing, it's going to be a bit of a red flag.
If you guys get to a redeploy tower, I think you can call me back in. Like, there's no dog tag system like PUBG.
What are they? And oh, I
You just
see.
have to get to a redeploy.
What do they look like?
I marked it on the
Oh,
map.
the balloon thing. Okay, okay.
Yeah,
You just want to try to work to it, just see if we can get them.
Yeah.
there's a blue AR on the table. Oh, that guy's not. Oh, he picked it up.
So I have oily skin. I skip all the creams on the face, so I want to use serums only. Your idea. I would just use like Kiehl's makes a really nice niacinamide serum that I would like look into. I think if you're looking for a serum and you don't want to feel greasy, that would be a really nice option for you. That's kind of interesting. So I picked up like defibrillator pads, but I'm not a medic.
There's those upgrade kits.
Oh, there's
too,
people
that-
on the redeploy.
There are. Let's mark another one.
Yep.
So there's one close to us. So, that's
kill
vehicle. That's a vehicle supply. You want to kill him? You said.
Let's just kill.
Okay, easy.
I pinged one over
Is
there.
that
They're
is that
right in the
is that your
open.
drone, bro, or is that somebody?
Yeah, it's my drone.
Okay. Any permanent solutions for psoriasis? There's nothing that you're very welcome. I'm happy to give you guys advice anytime. I love helping you guys. Down below us, multiples.
Oh, tank.
Oh, I can't hit anything. So also, when you call in the mortar, it gives you like a thermal, you know, like so you can see thermal imaging. Pretty cool. Hand, foot, mouth advice. You know, obviously avoidance is the key with that. It's kind of a viral illness, so you kind of have to ride it out. Supportive care.
Somebody watch my
Stay
back
hydrated.
before I go see if I can redeploy them.
Okay. There's a tank out there, as you know. I can call in a mortar just to keep them covered. I'm gonna put a mortar on the tank. Paint the tank. It's down. You should be able to push for it. Airstrike's inbound.
Oh, literally, you just have to tap it.
Oh,
That's
someone
sick.
called a mortar on me too. I saw a glaring red laser looking at my butt, so If you are at that tower and you can get me back, I'll take it.
Yeah, he might have to.
Yeah. I was like, there's a giant red laser looking at me. Can a dermatologist treat Merkel cell? So if it's Merkel cell, really you're going to bring in other oncologists and that. So a lot of these are treated with radiation and also some of the new immunomodulators. Chris, have you had any Merkel cell really?
Are you coming back?
Yeah, we're redeploying. It says awaiting redeploy.
Okay.
You need to move for circle though.
I'm not too far from circle. I don't think.
Yeah,
Am I?
but it's insta death when this circle touches you.
Like, is it actually coming in though? Are we actually getting redeployed or not really?
Yeah, we should be getting redeployed when the circle closes.
Oh, when it closes. Okay.
What was your question, sir?
Oh, have you had any Merkel cell patients? Patients Merkel cell?
Yeah.
Yeah.
Not a very good one to have.
No, it's not a good one. They're asking if dermatologists can treat it.
Yeah. I mean, you could do wide local, but ideally you want to do most.
Yeah, gotta do. Yeah, and they're usually also gonna get like sentinel lymph node biopsies and things too. So
Yeah, belong. You got a guy right up the hill.
take him out, boo. Weapons free, bro. You got 3 grenades too.
My teammate left me, guys.
Oh, bro, we're gonna get you in here, and we're never gonna leave you. Oh, squad eliminated.
Oh no, we suck again.
Yeah, we tried. We tried. Okay, we're backing. We'll get you in, Chris.
Let me exit them.
Yep.
Back to menu.
Yep. Quit the menu. So someone said research vitamin A for oily skin. So yeah, we use tretinoin a lot for people, you know, with acne and that kind of thing. It's interesting because I think the reduction in oil production with topical tretinoin is not like really great, but obviously people are going to feel more dry from that. When you do Accutane, people definitely get dry. So we got 4. Everyone's in the party. You ready, guys? Need anything done?
No, I'm good.
Okay, everybody good? Got a mole removed a few days ago and is bleeding. What should I do? Well, anytime you have something bleeding, I mean, you want to put pressure on it, but it's always a good idea to reach out to the person who did it for you and discuss with them. So I'd talk to them. Cousin wouldn't give you Accutane as a dermatologist. So yeah, I mean, there's different reasons for getting Accutane, usually trying and failing most of the easier treatments. If it's severe and nodulocystic and it's simply not going to get better with the good treatments, or if you're scarring, like those are all good reasons to do it. I think a lot of dermatologists do it. We know how effective it is. So most dermatologists are pretty, I'd say, chill about putting people on it if they need it.
Yeah.
It's really hard to honestly stick with like just a topical routine, especially knowing it's only going to fix it while you're using it. Can you send me the name of the serum? I think you're probably talking about the Kiehl serum. I would just look up Kiehl's niacinamide serum and it'll come right up. I believe that's the one you're talking about. I love La Roche-Posay as a brand. I love their cleansers and I certainly love their moisturizers. That's some of my favorite stuff. They do have some innovative sunscreens with a variety of things in them. Like they have some now with azelaic acid in them, niacinamide in them, some with hyaluronic acid in them for hydration. So they actually have a whole, like this whole SPF 50 line, which I do actually really like. They're all chemical based, so they're pretty elegant, you know, and then they have these targeted actives to help people with different types of problems. Thanks for the follow, guys. I appreciate you guys. Thank you. If you guys, so we're at like what are we at, 6,300 taps. If you guys want to tap that screen, it really helps a lot. Thanks so much for the heart, me. I appreciate you. Just tap that screen, run those taps all the way up to the top. If you guys love skincare and you like asking these questions, feel free to tap the screen. It really helps fuel the live up and get a lot more people in the chat and get a lot of good questions. And thanks for the follow, Manny. I see you. Thank you.
It'd be nice if we had a Strider in here to somebody to play, you know, medic. likes to just run around and res us.
I'd play medic if somebody wants to play recon. Don't matter to me.
I think we have 2 recons, an assault, and a NG.
Well, we're
Can you
positioned.
change in game, I wonder?
I don't know.
Maybe we'll get lucky and pick the paddles up like last time. So, Sezzy, your jump leader, bro. You got to pick it. When you jump, we jump with you.
Oh shit! All right, where are we going?
Brother.
Let's go. We're going golf course.
Golf
boys.
course. Nice. What's the best face wash to get rid of acne? I really like CeraVe Acne Control Cleanser. I also like the 4
It's got to jump for us.
4 or 5% benzoyl peroxide cleansers. Going solo, is that someone break off of the... Oh wow, this is hot.
Oh gosh, it's hot as hot.
Yeah,
It
man.
is hotter than hot.
I'm gonna be a little scared, bro. I'm not gonna lie.
I'm going far. Big far.
Yep, I went to the other side, and I think I'm in danger.
I'm really in danger. Oh god.
I'm with you, Dylan.
Oh, where's the guy? Good.
Got him.
Okay, good. It's awesome. Played up with 5. Or yeah. Your story is different for you, Chris.
Yeah.
Move is down, bro. We gotta get to him.
Yeah, I got hit with a grenade launcher.
We're gonna get to you, bro. Don't worry. I'm allergic to water on my hands. Do you know any solution? So there are people with like... Go ahead, Chris.
I was gonna say,
We
I
got
don't think
people right
that's...
here on the corner.
You think it's real?
Nah. Can't be allergic to water. You die.
Got 2 down. Team wipe. Move. I'm coming for you, bro.
Hang in there. That's it. Stay
Where's
with me.
Boolong at?
Beautiful. Move along.
I owe you one. Come on.
I'm reviving.
Reviving who? Oh, you're reviving. You died.
Says he died.
I died.
Oh, says he.
I know. Like a little pup.
I think I hear people. Yep, they're outside. They're outside. They're inside. Need help? Got one dead. Got one broken.
I don't like the look of them.
He's white. He's white. There's 2. There's 2.
Oh, yeah, there's 2 right there. One had a shotgun.
I don't know what to do.
Down below you, Sezzy, if you jump out a window.
I'm below you. You say?
No, we're right below. We are right below you. We were.
I'm in.
Oh shoot. Come on.
You got another one coming right behind me.
Damn, I'm down.
No! I'm down.
Good job. Good job. I'm down, says he.
I
AHA,
know, there's this guy.
you know, AHA is definitely not that expensive. You know, you can find all kinds of alpha hydroxy acids. You can get them from a place like The Ordinary, really cheap and easy. So, Jill, thanks for the heart. Me, how to identify your skin type? You know, if you're talking about like the oily dry combination. So if you can get out of there, says he, we all come back.
No, fuck.
And
Right when you said that.
Sorry.
You literally
In 20
had
seconds.
to wait 1
14
second.
seconds. 13 seconds. I think.
You should redeploy no matter what.
Oh, okay. Good.
Yeah, you always get 1 free redeploy
One
when you
free
get
one.
knocked. And then after that, you have to have somebody hit the tower for you.
Okay. Oh, shoot. I think somebody dropped that. Careful, there's enemies over here on the roof. They're shooting at me now. Oh, gosh. I'm down.
Oh god.
Guy landed on me somehow. I don't know what happened there. I think he redeployed on me. Should I be using different every night to help with skin health? Definitely using
Yes.
different every night. Yeah, 100% is like one of the best things you can do. Cicalifate Restorative Protective
Camping a
Cream.
corner.
It's a people love it, honestly. So, you know, I think it's a, you know, a great treatment, obviously, to protect and moisturize the skin. Continuous lupus scars my face. What can I do to slow this? The most common treatments for that are going to be things like Plaquenil, which is a prescription pill you take, and then also your sunscreen, because UV radiation and sunlight is going to be one of the big flaring agents for lupus on the face.
You got a bunch of them right below you, Bulo.
I know.
They're redeploying right now.
There he is. Yeah, heck yeah, boy. He went. Oh, what blew up? Oh! Looked away at the last second.
I know. I looked away to the right because I saw those gunshots.
Yeah.
Yeah. That's what happened.
Squirrel.
Squirrel.
You like hear the clink, 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 clink. Oh, that's good. Okay, I'm gonna throw us back in. Best way to clear acne is Accutane. There's really no other way to clear it. You pretty much gonna take Accutane, you're gonna grow out of it, pretty much. Age out of it. Best soap to wash the face with. I love two cleansers I love so much. The CeraVe Cream to Foam Cleanser, and I also actually like the Rock Barrier Renew Gel to Foam Cleanser. Those are very good. My daily, the Tolarian Foaming Facial Cleanser from La Roche-Posay too. This one's very good. I don't know if Chris has any other favorite just cleansers for like kind of normal skin, just daily.
The ones you said are bomb. Concur with your assessment and plan.
Thank you, thank you. My attending occurs. Best way to get rid of scarring. So scarring is tough because it's like you really do need procedural stuff to kind of help improve that. There's not like a easy way at home outside of just doing a good skincare routine, taking good care of your skin, and that, you know.
I did hear assault was kind of a useless class since you're not capping. I don't know.
Wow, bro, you trying to call me out?
I'm just saying
No, dude.
that's what they said. That's what I heard earlier.
Really? There's got to be a reason. Okay, I'll switch, bro. Fine, dude.
I mean, I don't know.
I'll switch, dude. Fine.
That was coming from Mr. Shroud's mouth.
Oh well, that's pretty respectable mouth. How can a wrestler prevent skin infections? Definitely want to wash with CLN. So there's something called CLN body wash and there's CLN sports wash. These would be awesome. If you further want to reduce fungal infections of the skin, which is very common in wrestlers, actually one of my chiefs in dermatology residency was a college wrestler, like state champion, and he developed a type of bar soap called Scrub MD, and Scrub MD is a myconazole bar soap, and that's a really good thing to try. So yeah, CLN, that's a great question. Any tips for Accutane? I would say get Dr. Dan's Cortibomb for the lips, get a lot of Vaseline for the lips, and for the body, get CeraVe moisturizing cream. You just know you're going to be pretty dry. You know, make sure you find like a good fatty, you know, food you like to take, like a avocado or whole eggs, peanut butter, something like that to take the medicine with so you absorb it the best. Circadia problems I haven't tried. So you guys are awesome. Thank you guys again for being here. Thanks for the follows. Thanks for the taps. Almost at 10K taps. I think if you guys tap that screen, run those taps up, you get us to 10K, I'd appreciate it. So I'm the jump leader, boys. We're going to the, you know where we're going. Going right to this one right here. Okay.
Okay.
We're gonna die.
No, bro. No, dude. No, bro. Is this hot over here? No, this ain't even
I
hot.
don't know.
The best way to battle alopecia, there's a lot of different types of alopecia. I assume you're probably talking about alopecia areata. And a lot of times the injections are going to be like one of the best treatments for that overall. But you can also use topical steroids like clobetasol, but those are prescription. Anybody see anybody here?
I think we're good.
We got some close over here. That big building.
Okay. Big building. That's the Nexus building. I think I saw on the map.
Yeah, that's where I seen a group land.
All right. So someone asked about peptides on the face. So peptides on the face are primarily, like, a lot of times they're going to be hydrating, but some of the more sophisticated peptides can maybe simulate to your skin that there's been damage to it.
Got people on me. Where's that? Yeah, I got people on me.
On you. Are you close? Oh, you're down. You're just right below me, man.
Yeah. People on this side.
Okay.
Need support at marked location. Stand by.
But yeah, engineer.
I am.
Move. They're safe right here. I'll protect. I'll guard you while you're cracked safe.
There's an airstrike here, boys.
Oh, got him coming up from underneath, Chris. Need you over here.
We're in the basement.
Coming.
Right under, way underneath you.
I ran out. I'm gonna go up the stairs. I'm coming up to your level. I'm with you now.
One.
Nice job.
Hey, you got it. Strike in.
Hypopigmentation. So what
Where are
about
they at, boys?
he got one.
Right where I airstriked.
Oh, okay. Is he like dead now? Oh, we got him across from us. Across from us, marked.
I see it.
Oh, like across.
They're moving.
Mission available. Request immediate support fire. Yeah, you got it. On the way. Rally on that location.
We got people over here.
Yep.
That side's clear. Move.
Nice.
Down one.
That was beautiful,
On the
bro.
backside.
We were both messing with him. Oh, we're about to get mortared. Oh, it's coming. Oh, dude, there is no cover here. Does this protect? Does this protect, bro? Oh,
No idea.
wooden.
I'm staying under it. I'm staying under it. I think
So,
it'll be fine.
A little bit of protection. Best product for psoriasis, Neutrogena T Sal for scale. T Gel is good. They're moving.
Right here.
I think they're in the building. Oh, big hits on me. Get some of that.
We're pushing it.
You push the building. Okay,
Which building is it?
the one you guys were on, but I don't see him now.
Mission is up. It's marked on your map.
Oh, they're on the backside. I'm hitting them a little bit.
How did
One's
that guy
one's
not
white.
die?
One's white. One's crossing the street, guys, behind you. They're coming back to the building. He's behind
There's
the.
gun, yeah, back there.
He's on the truck. He's on the truck.
Got a danger point.
Which truck? Ping it, bro.
It's pinged. It's pinged red, bro. What are do you want? I've
My
been.
truck.
Don't even tell me that, bro. Here, I'm coming at you. I'm coming. I'm bringing a drone over. He's moving.
You got one in the building right to your left?
There's 2 there. There's 3 there.
Yeah.
Okay. There's 4 there. No, I'm pinging it. I just don't know.
4 there.
There's 4 there. Wow.
Look alive. A friendly's redeploying.
I'm sorry. Sorry, Bulan. Why would I get a rash after being in the sun? So sometimes, Jill, people will get something called polymorphous light eruption that you can get, and it's usually in the spring months where people will get like another artillery coming. Ouch. And for most of the time, just protecting with sunscreen is the key with that. This thing is hitting, bro.
Jesus. We need more shields, man. They're
I
like,
know.
oh,
I know.
I gotta fix this loot
Scary.
shit.
Yeah, it's very sparse.
They're pushing on me.
Okay. I think we fell back a little bit, so we might have to relocate.
Yeah, I'm moving towards you guys. We have those guys right behind us, though.
Oh, at the Nexus? You coming back, Boo?
Yep.
Okay.
Yeah, I get this car. Should I pick you guys up?
Oh, shots from us. I think from Nexus building. Yep. They're
Yep,
marked.
yep,
They're
yep.
marked. Red ping. So you can
Ouch.
you can see it on the compass, but it doesn't show up on the map. Like unless you mag out. Are we? Oh yeah, nice.
Long said he didn't want to ride.
Nope. I need to get plates and stuff.
How do you get rid of dark circles under the eyes? Yeah, they're really tough
Guys, I don't know
issue.
how to drive this. I can't drive it. Okay, someone else drive it. It's very hard on console.
It's okay. Here, hold up. We gotta go in.
Oh yeah, kill these little clowns.
Yeah. I hear them. They're close. They're so here, bro. If it's pitted acne scars,
Chemical peels.
chemical pills, lasers, air
Oh
defense.
shit, fire's on us.
Yeah. You gotta remember too, it kills in one hit.
Yeah, I forgot.
How far have we got to circle? Not too far. I love the way they did fire in Battlefield 5, and this is actually pretty awesome too.
Pushing up on you, Bulong.
Yeah, I was already engaged.
So, are we gonna fight this with the fire coming? Are we fighting this, or are you coming, or?
Nah, I'm
Just gatekeep them if you guys want.
Accutane is the best treatment that there is for acne, and the only thing that can cure acne permanently. Marksman kit.
Oh, up here.
Oh shoot. Okay, I'm with you. What?
Shh.
Where are we going?
LMG's hot garbage.
Yes.
Where are we going? Where are we going?
Takes so long to aim down sights.
I don't know. I'm kind of stuck here, man.
Yeah, we gotta get out of here, bro.
I was gonna go up here.
Oh,
They're right
this
here,
fire's
right here.
so close over here, bro. I'm gonna try to come up with you. Oh, they're on me. They're on me.
Oh god,
coming
yeah,
up. I'm coming
they're
up.
on me too. Nah, we're coming up.
Where you at?
I think they're trying to figure out how to escape the building too without dying.
Here. There's windows over here.
Oh my god.
my god.
Oh my god.
Oh my
shit.
god. I'm out.
That is hot.
Scary,
Hot
bro.
lane.
Dude, it's so. I love the intensity of that. It's very cool. ice pick acne scars. I think that's what Chris was responding to. Like, you can treat them with phenol, you can treat them with TCA. This is something that you're gonna absolutely.
Right in front of you,
Yep,
Dylan.
yep. Thank you, thank you.
Hill.
Oh, in the hill?
Yes.
That's not
Edgy,
good.
right?
Yep, I saw that both.
Going through that door.
What door?
Squad right?
That door.
I'm just kidding, bro. I need help, Chris.
There's a whole lot of them there.
Yep. Yep.
There he is.
Make it
You
rain
see
on
him?
them. You got a drone strike or an airstrike.
Yeah. Is he gonna kill me though, you think?
Ah, just run away from it.
I have no plates. And that was actually kind of crazy in the building. And you guys didn't even gas me up, bro. You saw me going off.
I was trying to stay alive. Sorry.
I was like spraying so hard, bro.
So why don't I come back yet? Because I never died. Is it done? Is the redeploy done? Is that why?
I don't.
Not?
We came back as a squad earlier, didn't we?
Yeah,
I never died. I never died.
That was weird. I know you did get a kill right before we came back too, but then you died. So, can someone mark? Is there a oh, there is a redeploy tower up here, huh?
Yeah.
Oh shoot. Why did that not hit anything?
Yeah. I don't know if that was the smartest move right there, buddy.
No.
Don't know.
No.
Just don't
Maybe
know.
I don't think it was actually. That's probably a good call. This is, you say this is the wildest BO6 live I've seen. So yeah, we're trying over here. It's hard to do it all, but we're trying to help people with their skin and stay alive. Top squad. We got a squad. We did get a squad wipe that game, which is epic. But look at the loots. They're like 8 chests is all that was open. That was the high. Move only opened 1 chest.
That's all I found.
I know that there's so few things. Treatment for prurigo nodularis. I've had a lot of people get great results with Dupixent.
Nimluvio.
And Nimluvio is a newer option that does reduce the itching, so it's approved for it too. I've actually had people have good luck with that too. The mixing of it's kind of crazy.
Nimluvio?
Yeah, you gotta like take it out of the fridge, let it thaw, then you like do something and it mixes like the powder and the water together, and then you gotta like wait 5 minutes and like let it mix. It's like a ritual, bro. Not sure if I know anything about tongues, but have you ever seen? Oh, have I ever seen what? I missed what the question was about tongues. Easiest way to get rid of acne: Accutane. Any long-term birth defects after taking Accutane? No. If you're longer than a month out and you end up getting pregnant and everything, there's no issues with, you know, birth defects at that point. What can you suggest for a person who has an outbreak of acute dermatitis while using upadacitinib? So, you know, some of those treatments are not always the...
Chris?
Oh.
Yep.
Oh, here, I'll back to menu.
Oh, you guys...
Yeah, we went in. I don't know what happened. Maybe...
Wow, I kicked me out, maybe.
Yeah, here, I'll back to menu and we can get together again. Let me know when everyone's in menu and I'll load us back in.
Is everybody in the lobby?
Yeah, let me know when everyone's in lobby and ready to go.
Yeah, I'm
So what's
I'm
the
in
difference?
lobby.
Okay, everyone's in lobby. All right, I'm load us in. What's the difference between psoriasis and dermatitis herpetiformis? Anybody? You want to take that one? So psoriasis is like it's related to the immune system, similar to dermatitis herpetiformis, but dermatitis herpetiformis is like a reaction to gluten. So of all the people you hear talk about gluten, that's actually one of the true things that is truly associated with gluten. So if you avoid gluten, the condition goes away. It's very itchy. It does tend to kind of show up sometimes on extensor surfaces, kind of like similar to psoriasis, but you basically can control it with diet. Sometimes people need, steroids and dapsone and different stuff to kind of control it before they get it all figured out and calm down, though. And you can diagnose that with a biopsy with DIF, which is like a special type of staining that fluorescence under a special microscope. The question is, have I seen like TBU something in the last 4 years? I'm not sure what the acronym is, to be honest with you. I don't believe in diet with clear skin is not true. So good diet is very important for your health, but there's only a few like associations a little bit with skin conditions and diet. I'll roll recounting in. Accutane definitely works. Yes, it's the best treatment that there is. How do you cure anything with darker skin types? I mean, a lot of the treatments are the same in darker skin types and lighter skin types. However, the conditions can look a little different, so that can make it challenging. And then definitely in cosmetic treatments, like especially with lasers, Fitzpatrick skin type is like a pretty big factor. Chris, have you continued looking at people's palms for hyperpigmented linear creases?
No.
No. Okay. I thought that was a great tip that I think you shared with me. But...
Oh, for PI. Sorry.
Yeah. You're like,
I thought I was looking at them.
Mm-hmm. You're like, bro, I literally don't. So yeah.
Actually, I actually do, because a lot of people don't understand the like the question. I'm like, oh, do you like get tan when you know?
Yeah.
Like, I feel like everyone always lies too. Like they're like, oh, I never burn. I always tan. I'm like,
that's true. That's true.
I don't know if that's true.
Yeah, that's true. Accutane 5 months, seen little results. Sometimes it takes people longer. I mean, it's not uncommon to see people on Accutane like 6 to 9 months, and a lot of times the best improvement comes like towards the end of the treatment. Anything to avoid while taking.
Make sure you're taking it with food too.
Yeah, it's a good point. So, if you want to explain, Chris, feel free.
Well, if you're like feel like the Accutane is not working, it might be like you're not absorbing it actually. So make sure you're always taking it with a fattier meal.
Mm-hmm.
Sometimes you want to switch it. So if it's not really working, there's like other brand names ones that are, sometimes absorb a little better too. So. But usually, 5 to 6 months, you just start seeing some improvement, really.
Oh, I'm ready to switch this up. Kind of messed this up, boys.
Damn, alright. We're gonna be like 15 minutes late to the fucking battle, but
I know.
we'll get there.
Well, we could a little audible here. Maybe less audible.
I'm just kidding.
No. This is the spot. This is the spot. This is where everyone wants to be.
You guys switched the spot on me.
Oh, you went rogue? What are you gonna stay with the squad, bro?
He broke off immediately.
That's
He's like,
crazy,
those guys are Dumbo. I'm out of here.
Yeah, I'm out of here. I don't like this spot,
I'm
bro.
up to you.
I think I hear suspicious footsteps.
I think
Oh
there's
my
the
God.
Team over here.
Yeah, there's one. Whoever's player 4. There's one on me that's low. Yeah, he's on my body now.
Oh, they're on me. Yep. Stun them.
How do you get to where you are, bro?
I'm down. So, HS, do you recommend what shower gel or washes? Yeah, the shower gel you want to use is called CLN body wash. Is benzoyl peroxide okay for the face? Absolutely. It's a great treatment overall for acne for the face. You just got to be careful because it can bleach fabrics.
Oh my gosh.
You guys, I need you to step it up here. Okay.
Yeah, that's true.
I killed one, and then I don't know where you guys went. I think somebody left the building hiding.
So why did
I'm
we?
in the building.
Why did
alright?
we read a? Oh, I see. It's showing just a video now. Body wash for psoriasis. There's not really any particular body wash that's going to be real helpful for psoriasis. You know, I would just mainly focus on using a good gentle body wash. Are you guys going to 3 or where are we going? No, 3 just had somebody land on it. Might go to this tall one here if anyone's landing with me. Oh, there's enemies there too. Don't go there. Ah, dude, I don't know where to go, bro. I'm freaking out.
You can't land on me?
No,
Rally on that RV point. Move.
Did you clear that?
It's been, yeah, I don't know. I mean, I hear people shooting, but no one on me.
It was on you, okay.
Guy high
See
up
the
here.
gear container over here?
One landed near me, which I marked.
Contact. Enemy infantry.
If engineer, I don't think we have an engineer, do we? Oh, we do. Move. There's a safe on me if you want it.
I'm over by Bulong, I think.
Yeah. GHKCU for acne scars. Again,
Oh, behind. Oh. Nope. Damn it.
Somebody just went through their move. I'm on your 6.
These crates are also very kind of annoying to open. I'm not gonna lie. They made it very like confusing to like go through a crate.
oh, because you have to pick up like everything individually.
Yeah, like I'm like just,
I think if you don't have anything, it.
Oh, on me! Oh god.
I shot a couple that were coming up on you, Belong, in the back, but I gotta move. It's like,
Oh, only one left. I killed everybody else.
oh, really? Okay. I'm gonna move to that building. You finished them? Hard finished them?
There's one I hard finished. One was down. The other one was down.
Oh, shoot.
But I think now
They got a drone up now, so got the drone down. I doubt if he's by himself, he's running a drone. So, can you guys mark? There's the buyback.
that's it.
behind you.
Is there one in
You're running
front of
away
me?
from
Is
it.
there one in front of me?
I'm going to the
Lucky
buyback.
that.
I got you guys. Don't
Oh, you
worry.
got 'em?
Dr. T on the move.
Dr. T.
Papa is getting his
Oh
friends
shoot,
back.
there's one right by me, boys. You see this? See this, boys?
Execute them.
He has no idea.
There it is, boys.
There
You
you
see
go.
it? How about that?
His friends are coming for you.
Where they at? Where they at? They coming up this?
I don't know. Your sensor was picking it up. He had a
Oh,
purple
I see him.
weapon
I see him.
too,
I see
though.
him. Oh,
Oh my god. Oh, shit me.
what did I get?
I would have done.
Got one down. Oh no! Oh, that's you. Thank God. There's another purple here for you. Purple weapons.
Oh god. Oh my god. Oh my god. Oh my god.
No, I'm
Mine,
getting
mine,
shot at.
mine. Yeah, other side. 30 minutes. All right, or 30 seconds. Where are they at? I think the shots were coming from. Oh, are we getting bombed right now? We're double bombed, bro. We gotta get out of here. We're about to get zonked. They're flying away. I'm going back to this building. Actually, I mean, I can come back up there, I guess, if it's over now.
Make up your mind, bro.
No, dude, there were 2 mortar strikes on us and we were standing in the open. I can't believe we lived. Best shampoo for itchy scalp. I like Nizoral shampoo.
Got landing in.
Okay.
You got plates?
I don't. You got any for me? Does anyone know how to even drop plates?
No.
I definitely don't. Oh, for me, if you tab, you can access your full menu.
Oh god! Oh my god! Oh no!
Oh, shots from
Ouch.
30. Yep. He's got sniper. So, hey man, very bad accident at the point. I have some skin peeling.
I'm not on the roof up here. I'm safe though.
Panda
Oh, you
eyes.
jumped down.
Says he's going for that sniper.
Oh, he's going up to him?
Yeah, there's one over here on my thing too.
I'm trying to put some supportive fire over there. So he's down a floor from you, says he, the last time I saw him.
That building's coming down.
Yeah, that's not looking good, bro. That's cinematic, bro. Look at him come, dude. Oh, there he is. Oh! Yeah, did you make it?
I made it.
Oh.
I went and I stabbed that sniper dead.
Did you? You got him. That is awesome. All right, I'm gonna fly to the redeployment tower to get moved.
Yeah, I'm down again.
So you need me to revive
I mean,
him,
I
right?
didn't want to say it, but we were all thinking it.
Man, I thought you were with me, and then I got knocked, and you were going
Listen,
up to a roof to stab a sniper.
I heard come up to the roof. I'm down up here, so I thought that was the roof I was supposed to go to.
No. I was talking about the roof that you were already on, and then you jumped down.
So you just gotta hit it and wait a little bit.
I don't even think you have to.
No, you have to. No, you have to wait. It's like a whole
I
process.
think they're on me, bro. Maybe.
I'm with you, bro. What do you mean?
You are not with me, bro.
I see you.
You see me is way different than you being with me,
I'm
bro.
Overwatch.
Okay, he's
No,
back.
like,
He's back.
Listen.
He's back. Are you guys
I'm
both
with
back
you.
then? Does that put you both back?
Yep, we're coming both. Both of us are coming back in.
Okay. And how long does it take?
We're shooting in on you right now.
Nice.
Did the guy tell you to cock it and lock it? Because that's what he told me, and I felt kind of a little
That's a little much.
weird about it. Not gonna lie. Yeah.
What's the best skincare product to use on my regular basis for men? So I would use like CeraVe Cream to Foam Cleanser as a cleanser. I would use Brandify Vitamin C. I would use, what is the Kiehl's sunscreen?
You better screen.
The
better
Kiel,
screen.
the Kiehl's Better Screen. Very good, even if you have beard hair or stubble, anything like that. And then at night, I would use a retinol. Rock is something that's very gentle and easy to get along with. You could use that. And then a moisturizer like CeraVe. There's not necessarily a cure for HS. The closest thing to a cure for HS is surgery.
Bimzelix works really well.
Chris has used Bimzelix. I still have not used it in HS yet.
Oh. My beautiful wife brought me a sandwich, so I'm gonna munch on this for a second,
so good,
okay?
absolutely.
While you guys stay alive, okay?
Yeah, get it while it's cold, bro.
I'm gonna do it.
Hey, you guys are both under me. You guys want to hop in this rig, bro, with me?
I'm trying to find a better gun.
Okay.
Go to one of the weapon caches, dude.
Yeah, bro.
I got a red SMG.
From a weapons cache?
Yeah, the ones that drop in like out of the sky. There's one on me.
Yeah, one just dropped too. Yeah, by move. Well, what's the best way to ping stuff? Like, there we go.
Yeah, one of these things.
Oh, is that what those things are?
Yeah. Oh, circle's moving. We also got a custom weapons crate over there.
Peptides are like one of my maybe like top 5 things. They're really good for people, especially like if say you tend to get irritated really easily from like retinoids or acids and stuff like that. And peptides can be like an alternative that's going to be very gentle and easy for you to use.
I'm coming towards you guys.
Thank you guys so much for the taps. Thanks for tapping the screen. If you like answering skincare questions or you like asking your skincare questions, feel free to tap the screen.
That weapons cache is like the crate in Warzone, your loadout crate.
Oh,
yes. Okay. Says he's a long ways away from us and we got to move to circle.
Okay.
Towards him.
Vitiligo usually going to be treated with various treatments in the office. So, you know, topical steroids are a common one. There are new topical JAK inhibitors, which are steroid free, that can help. You can use narrowband UVB, which is a medical procedure that's done in the office. It's kind of like, looks like a tanning bed that uses UV light to suppress some of the immune reaction in your skin. Those are all options that can be done for it. Base Bodyworks I haven't used. Medicube products, they are definitely legit. There's people that absolutely love them. And I actually like a lot of the Medicube products myself. So yeah, Medicube's great. Pinpoint flat spots on your arms. It's one of those things probably got to see in person to really like, you know, just, you know, we got some enemies far here. Let's see what else we got. We got a chopper going down. I don't think they survived from the looks of it. How do you mount the...
Then we got people over there.
Oh! I just hit a dude from so far, bro. The sniper. They're getting him up. They're rezzing him. Only rezzed him. No. How do I wish I could zero this thing. 459. Oh, I see. I see how you do it now. 5. Do you think there'll ever be a cure for psoriasis? I definitely think there will be. 300. So this needs to hit at 400. But this is pretty slow. How are we doing here, boys? Belong, what are you doing? You're all the way over there?
He's protecting me.
Is he? Well, protecting him.
No.
Fire's coming in on me, bro. Flying to you guys. How long do I think? I think it's really hard to say. I think AI is probably going to change a lot with drug development. I think you're going to see a development of a lot of different types of drugs with the help of AI. Accutane 2 months ago. I don't have acne anymore, but my skin is still textured. Is it normal? Yeah, of course. I mean, we all have textured skin. You know, it's not a, you know, it's not like you got a fully ablative like laser resurfacing laser. And even if you had that, you know, you're still going to have texture a little bit. We got enemies.
People under me.
Enemies, yep. Dropping a
bottom floor.
Yep. Boys. Hit one for 100 with a grenade. Oh man, I'm so cooked.
I'm with you, Dylan. I'm with you.
Right. They're here. Oh!
No way.
I did very little work there. I hit one with a grenade, which felt good, but outside of that, it was bad. Chat, I'm gonna be back. I'm gonna be right back. Thank you guys for all the great questions. I gotta run to the restroom. I'll be back. 1 second.
Oh no, we suck again.
Yes. Truly, badly, deeply.
Wiped out. Don't get hung up on it.
And walk away for 1 second, bro, and you guys give up. What the heck? So
I
squad.
blame Bulong.
Yeah, it's Bulong's fault. But at least Bulong got to loot 8 chests. So is it? Let me know if it's pulling you in on this, Chris, because if we have to back the lobby every time.
It says it's no, it's saying matchmaking on the bottom.
Okay, good. So we're good. So does Milia go away by itself? Sometimes it does, but sometimes they either need to be like nicked and expressed, or you need to sometimes use like adapalene on them. Is acne side good? I'm not even for sure what that is. What do you recommend for psoriasis when it's starting to fade? So the redness and pinkness of psoriasis is the first thing to show up and the last thing to go away. So really, there's not a lot that helps the pinkness outside of just letting some of those blood vessels calm down once the plaques are like gone. I got red sacks full of goo on the side of my nose. How do I fix this? So I'm just trying to imagine what you have. I can't help but think maybe it's like, I don't know if it's like rhinophyma. What's going on? Sacks full of goo. I don't know. Tomorrow I got an appointment with you at 7. Oh, well, very good. I will see you tomorrow. So very
You work
good.
at 7 a.m.?
I do. I have my spot clinic tomorrow. So yeah. So we start at the spot clinic at 7 because the rest of my schedule is completely full. So I'm like, the only time I can do it is add on an hour to the day. So
Is Belong in here? Or do you leave?
Yes, sir.
He's coming.
I'm just
Hopefully.
going to make a random appointment for Dylan and show up one day without him knowing.
Blood thinner.
Who's Ashley Jordan then?
Yeah, I have no idea. Yeah, it shows us with somebody else in here, but is it loading you in still, Belong?
Oh, you guys are loaded in? No, I'm in the lobby still.
Oh my god.
See?
Okay, good call. I'm bringing you back. Let's go to lobby. So,
Yeah.
Twitch chat. Yeah. So it says, have you heard of a new drug, rimibrutinib, for treating chronic urticaria? I want to say that.
Yes,
Yeah.
I have.
It's oral pill twice a day, right?
Yep, it's good.
And
I
it's
heard.
a BTK
No side
inhibitor.
effect, no moderate. Yeah.
BTK inhibitor. So we have heard about it. The both dermatologists in the live have heard about it. So yeah, I think it's good. Yeah. I think it's good to have options like that because obviously chronic urticaria is like a very distressing condition. And if you can't get it controlled with antihistamines, and maybe you do or don't want to do Xolair, or you tried it and failed it, maybe, you know, then it's good to have another option. So yeah. So yeah, there's no, so there, I didn't know, Chris, about the warnings. So there's no warnings, no nothing you gotta worry about.
Yeah, you have no lab monitoring, which is awesome.
That is awesome. So are we all
Back
in
to
lobby?
lobby.
Okay, everybody in lobby ready?
Yes.
Okay.
Ready.
How common is it to get eczema as an adult? It happens. It's not like super rare, but I mean, the most cases of eczema are going to happen in childhood. But you definitely can get, especially like variants of eczema, like nummular eczema. You can definitely get that as an adult. Best way to get rid of eczema, a lot of times if you can somewhat age out of it and it kind of shifts to more to seasonal allergies and things like that, but there's no cure for eczema yet. Dupixent's about the best treatment overall. What can I take for plaque psoriasis besides ointments and creams? There's a lot of different treatments now. There's like oral JAK inhibitors, which are steroid free, that can kind of help with psoriasis. There's also mini injections. Like the injections work incredibly. Taltz, Cosentyx, you know, those are like, I prescribe a lot of Taltz. I like Taltz personally, but there's a lot of different ones out there. So how to calm down, I think you said like scalp folliculitis. So scalp folliculitis, I use a lot of doxycycline for. If it's bad, sometimes we can use Accutane even for that. I'm happy Urticaria is finally getting a new drug. I totally agree, blood thinner. I really, really hope that it's helpful for a lot of people. Hopefully it's easy to get. Stop boils for recurring in the same area. So probably you want to look into hidradenitis suppurativa or look up HS skin condition. And that's probably, if you're getting quote unquote boils or folliculitis in the same area and over, it's probably that. But always you could talk with your dermatologist about it. That's a good way to do it. Thank you guys so much, by the way, for being in the chat tonight, asking all the great questions. I like to remind you guys, if I didn't get your question, all you have to do is just ask it on one of my recent videos. Just ask it on one of my recent videos. I respond to all comments on my videos. So if you have anything that didn't get answered here, it's very easy to pop over to my most recent video. You tap a follow so you know when I go live, you know when I post a video. And then if you just ask it in my most recent video, we'll make sure to answer that for you in case I miss it tonight. Someone asking about an antibiotic. It's not one I currently use. How do I get rid of acne under the skin? Usually going to have to do very consistent use of topical acne routines that are prescription. Again, benzoyl peroxide and adapalene are about the best you can do over the counter. Red pink moles concerning. Some can be, but sometimes older moles that have been around a long time can be more of a pinkish or skin tone hue. So you can kind of see that. Jonathan, thanks for the follow. If you're getting off birth control pills, says he's jump leader. So if you're getting off birth control pills, yes, acne can flare some. So that definitely can happen.
Where do you guys want to go?
You know,
jump master.
You know best, bro.
Take us down.
Yeah, land is soft, bro. Does creatine accelerate hair loss? I'm not a big believer in that personally. But maybe it's because I want to keep taking creatine. No, I don't. It's kind of interesting that it like has a formation thing, you know?
We have at least 2 teams, if not 3 teams with us.
I don't like that, bro.
So you're saying there's a chance.
Yeah. You want to go to the right? Or we're staying here? All right.
Landed. Question is, oh shoot, I just landed right on one. Wow, I missed every shot. No, I got it. I'm with you, boo. Thirsted that one. Move is down.
This guy's low. Two on me.
Shoot. I'm still running pistol right now. I'm trying to. Oh! Ran into 2 of them. No, dude. Why is my back itching? Oh, they're on me. I'm a host. Spotted him.
Who's up, says he? That's it?
Yeah, I'm up.
Yep.
All right.
So any kind of device is only says he's down. Any kind of device is only as safe as the person like treating you with it. So, you know, you can't perfectly say like any kind of RF device is safe because it really depends on how people use it and the settings and that. And that's why credentials are so important in seeing somebody that like you can trust.
There's guys on the roof there too, by the way, just so you know. Yeah.
Good.
Oh, we're
Thoughts
fucked.
thoughts on tretinoin? Tretinoin is one of the best treatments that there is for your skin overall. Helps with anti-aging, acne, wrinkles, dark spots. It's amazing. So I'm back. The boys are coming back soon.
I redeployed and died instantly to a shotgun, so.
Well, you want me to just redeploy you again?
Yeah, I think you're a long ways away from Bulong, though, aren't you?
Well,
Oh, Bulong died.
I can
So you
redeploy.
gotta just
Oh, there's
redeploy.
enemies there. There's enemy there. Mark me another redeploy.
Well, we're all coming back. Just stay. I mean, we're all back already.
Well,
Just go
he
somewhere.
already died.
Yeah,
Wait,
yeah,
move,
go to that
move,
redeploy to your southeast.
move already
I
died.
think, yeah, Greeney's on it.
So the problem is I think I gotta stay here. And those enemies are close. I've had acne for years. Do you recommend medication or just esthetician facials? So facials are definitely not gonna clear up your acne. So, you know, actual medical treatment would be the way. What do you try for nerve itching on the scalp? If you can find a Promoxine spray, that's like something nice. I've actually seen some vaginal Promoxine spray that I've used on the scalp before.
Gabapentin works too.
Or gabapentin, which is a pill. It can make you feel a little groggy, can make you sleepy, make you dizzy, but
It's basically a free sleeping pill.
free
You're
sleeping
welcome.
pill, free. Can you take Accutane without
for it.
birth control? Technically, you can use
Yes.
abstinence as a form of contraception, and you wouldn't need birth control. The number of times I've done that is like 1 or 2, maybe though. Chris, do you do that regularly?
Very regularly.
Really, bro?
Yeah.
What do you just put it in their hands? Let Jesus take the wheel?
Yeah. Let Jesus take the wheel. It's not mine. I give them the risk. It's the patient's
Right,
prerogative, you know?
Yeah.
Like, you can't get pregnant.
Yeah, right.
I've had it once ever in my life that someone actually got pregnant on it, though.
And then they come in and they say, they're like, I'm a mommy. And you're like,
Mama
like,
Sita.
Mama
Oh,
Sita.
guys in front, guys in
Yeah.
front.
So I literally have a pistol, bro. This is not good. And this guy's got a sniper rifle, by the way.
Both do.
Both do. That's not good.
Yep.
Is this
I'm
ammo?
moving.
This is a vehicle supply station, so that's not very helpful. Move is in the tower. So, anyway, your patient comes back. They say, I'm a mommy. And then Chris says, oh my
That's
God,
what
you're
I say.
pregnant on Accutane. And then they're like, you said I couldn't get pregnant. And then you realize
then I
there's a
say-
major misunderstanding.
No, then I go, do you see this form you signed?
Oh,
You
okay.
stated you understood. You
Yeah.
cannot get pregnant.
Yeah, it's true. You just so these fences. Are there ever any holes in these fences?
No, but seriously, you should actually try to be on birth control while you're on.
Better to be on birth control for sure.
Yeah.
So we're in a bad spot here, buddy. I'm dead, guys.
Are we all running the same way, or is Dylan running away
No,
from the fire
I'm
like
running
normal?
in the wrong way, bro. But I think I maybe found a truck. Oh, this truck doesn't work. That's great.
You guys didn't call out the running away thing.
Yeah. I
pushed him with the shotgun.
Oh no.
Oh God.
All right. So is it okay to stick with tretinoin 0.025? I think if you can use it regularly, I think that's more important than maybe going on the strength. But if it's not irritating you at all, there's nothing wrong with going up. But it's the same in the UK. Yeah, same stuff in the UK. Doc, is spironolactone bad to take? Spironolactone is one of the most common things I use for adult women's acne. New itchy bomb
Well,
6
I'm
weeks
picking
after,
you up.
but no new burrows.
There's
Which is me.
a team by me, by the way.
Sometimes you need to be
they're about to get
retreated.
me
Like
next
so,
to them.
if you treated for scabies one time, sometimes you need 2 treatments. Diet and gut health is more important than everything. So agree to disagree on that. I mean, obviously a healthy diet is very important for your health, but most of the time you can't just simply change your diet and cure
Oh
your
my
skincare
gosh.
problems.
Oh God. Oh God.
You're okay, says he. Stay calm.
Yeah, fire's right there.
Just stay calm.
I'm dead. You know, revive me.
Yeah, revive him. Take your time. Everything's fine. There's gigantic oxidizing gas tanks right by you
Oh
too.
wow. Oh yeah,
Run,
yeah, yeah.
Go, just go.
No,
just
no,
go,
get
just
him
go,
up, get
just
him up,
go,
get him
just
up, get him up.
Go, go.
I'm just kidding.
I don't listen to you. I don't listen to you.
All right.
Oh, you got guys in front of you too?
Yeah, don't
I saw him.
don't mess with them, bro. Long burn up in the fire, bro. Ooh! Ooh! Whoops! Boom!
Got him.
Boom!
Got him.
Surprise!
Motherfucker.
Yeah, I didn't expect to bust through that concrete barrier. Yeah, like he's like, I'm safe. Like, no, you're not. You're not, because I just went through an entire concrete barrier. Do home red light therapy work? It is the cherry on top. So if you're doing a good skincare routine, reasonable to, you know, add in red light therapy. Every company kind of has a different protocol as far as like doing it. So some people, you know, they want you to do it daily, some people 3 days a week. So it just kind of depends. No, stay in.
Oh, that vehicle's so about to blow up.
I don't even answer. You're crazy, man. I've been answering hundreds of questions. Thoughts on GHKCU? A lot of questions about this, and honestly don't know if I got any great advice on that. Advice on chronic urticaria: you want to maximize your antihistamine use in a safe way. That's the typical way. So things like Allegra, Zyrtec, those kind of things. After that, we were talking about some of the new treatments for it. If it's really resistant, then you're going to look at things like Xolair, that, you know, usually allergists are going to give you.
Are you guys coming back?
Yeah,
Yep.
we're coming back.
I was like, that fuck did that shit not work?
Yeah, all right, you do all that and it doesn't do anything. So what do we see? So let's see here. Advice on how to get rid of big pores. What I would suggest to you is there is a treatment called Remedy for Pore Size, and that's a good option that has multiple ingredients that help fight pore size. Kind of keeps pores from getting gunked up and making them look better. So I would look at that. Every cleanser makes my face worse. What can I do? I mean, I guess you could just wash with water if you wanted. I mean, if you're not having any trouble and that, just wash with water. If you're looking for like the most gentle.
Oh, guys up here, guys.
Yeah, they're above us.
No more second chances. But why?
Oh, I'm getting glinted. They're still
I couldn't even
upstairs.
see that dude.
Ooh, God, I hit him a couple times, bro, but I'm scared.
Right behind you, Dylan.
I
3 of
know.
them coming up out that door.
This is a runaway.
Can I bust out of this?
This is a-
Can't make the jump. We're screwed. I'm hosed. Oh, I mean, I was trying to fight it, bro. I mean, I was actually trying to run, but I did shoot back a little bit. 70% rubbing alcohol on your face, not advised. So it looks, so if I look at the bottom of the screen right now, I see that one of us already dropped.
Alex or Mosey?
You see that?
Yeah.
So it only shows
I
3 people.
Backed out.
So yes, you backed out?
I'm gonna be dropping. Yep.
No, bro. Let's roll one more. One more.
I already closed the game.
Oh,
GG's, boys.
I love VIPO, by the way. Thanks for rolling with us. Good games, good games. I wanted to just say, hey, chat. I appreciate you guys being here. You know, we've had about 10,000 viewers come through. This was really good. We were playing Battlefield Red Sec tonight. We answered lots of questions, probably hundreds of questions about your skin. But if I didn't get them answered for you, just go to my most recent video. Tap the follow right now. Go to my most recent video and ask it on a recent video. I will answer those questions. I answer every comment in my videos. So feel free to drop that on there if you guys still have questions. I'm going to go ahead and shut down the live stream. I appreciate you guys being here. Thanks for hanging out for a couple hours with me. It's been a great, nice night. I might see you guys again this weekend. So make sure to tap that follow if you guys like this kind of opportunity to ask questions. So thank you guys so much. I'm going to shut this down and we'll see you guys soon. Okay. Thank you guys all so much. I appreciate you guys. You guys rock. Thanks so much. Appreciate you.